What's up, Joe? 310. All right, so I'm going to give you a quick feel for what it is I would like you to do. And just again, I want you to have fun with this. And and when you're being creative, you're going to learn from it. And I don't want you to stress out about it. All right, in terms of this concept, if you're going to create a go-to site for patients that are suffering from the kind of cancer that you're going to be a specialist in, and maybe you're part of a group, okay, and that's okay to do this as well. I want you to do this individually, but maybe you're going to form um, the um, the Walsh, pancreatic cancer group or something like that. Okay, all right. So, all right. So again, you don't have to reinvent the wheel. You can look how other programs have done this. Okay, how they approach it. So I showed you this right here is the breast cancer website. Okay, and each of these um, hot items, okay, on your hyperlinks within your website. Pretend it can be just PowerPoint if if you want to create a website and you have the whereabouts to do it, that would be cool. But if you just want to create a PowerPoint, you just pretend. All right. All righty. So yeah, so we can we have all these different approaches that are consistent within your group. Okay. And so you can, so you see right here, radiation, chemo, gene therapy, clinical trials, it's all this kind of stuff that's for this breast cancer group. Be creative on that. And that came over under the hyperlink of treatment plans. Okay. All right. Cool. So what you're going to do is you're going to, create your website. All right. And it can be just a PowerPoint. Now, for me, you go in here, I personally do not like to be constrained by the automatic default of PowerPoint, which is that putting those boxes in. So in terms of my layout, I went to here and I went to blank. First of all, okay. All right. Then we're going to come up with a concept. All right. Um, so we could call this there we go. We're going to call it the Trestles um, I will make it even more specific. Trestles lymphoma specialty clinic. All right. All right. So I just came up with a name. All right. I can, obviously I'm going to blow it up. Okay. So I can, just, boom, 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 boom. And we're going to put this over here maybe. Okay. So I'm going to put it right there. And maybe we should come up with a little bit more fancier, font. So let's take a look here. All right. What's a cool looking font? All right. How about copper black? All right, there it is. All right. Okay. There it is. All right. And then you can create a background if you wish or whatever. Okay. All right. So you would put a little spiel right here of that's um, uh, your philosophy, if you would, or into treating patients with lymphoma. And then you'd go, and from there you would go off and just say, um, um, receiving a diagnosis of lymphoma, is a very difficult, sorry, let me get my head out of here, very difficult and difficult life experience, and we are here to guide you and provide state-of-the-art approaches. Blah, blah, blah. So I'm just rambling here. So this could be on your page, okay? All right. But you know, put some effort into it. Make it feel like this is something really cool. And again, your reference point is, you know, you go back here. Oops, sorry, I went to the wrong tab. All right, so your reference point is you go over here and you just kind of check it out, right? So I chose lymphoma. So we can go into this website, right? I'm going to click right here, right? And alrighty, so we see we have these different approaches right here, okay? In terms of this particular team, okay? And you see down here, cancers and blood disorders that are treated. So boom, 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 boom. All right. So you can make these kind of a sub category within what we're doing over here. All right. So this is right here. It's called again, in terms of the hyperlink, we're under this concept called hematological malignancies, and everything under the sun is shown right in here. Okay. All righty. So you could do something similar like that. Okay, so how are you going to do that on your website? So you're just going to come over here. Okay, and okay, we're gonna okay, awesome. All right, so kind of like they had it, we just go like this. Okay, and what we can do is I'm going to change how the color of my shape fill here, and awesome. So I think something a little less dramatic, maybe. Awesome, like that. Okay, alrighty. Because it's trestles and I'm in the water, right? And then I'm going to go copy, paste, 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 paste. Okay, boom. All right, so and all right. So I'm just going to delete. That's enough, right there. My guess. Okay. All right. Cool. Alrighty. So there's a lot of different ways we can go this way. All right. We go back to that website. Okay. Rather than do it the way they did it, where they had hematological malignancies, bone marrow transplantation, myelodysplastic syndrome, CAR T therapy. Why not we just do it according to these different types of lymphomas and leukemias, right? So right here, all right, so this one is called acute lymphocytic leukemia, all right? All right, so I'm gonna go in here, so, and I'm gonna go back to my website here, and I am going to come on, you. All right, wait a minute. Sorry. There we go. All right. Acute lymphocytic leukemia. I can't spell. All right. And AL. Oh, sorry. All right, there it is. Okay, so that is my one of my choices there. We can maybe, you know, in terms of the text, you know, we'll just choose something that's a little there, like that. All right, awesome. Okay, okay, and then you can choose other cancers down through here. You know, you can do whatever. You know, it's your program. This is, you know, how you're going to set it up. Okay. Alrighty. So, you know, in terms of this guy right here, then, and then here we'll do another one right here. Well, and what's another? How about we'll put in here. We're gonna put in chronic lymphocytic leukemia. Okay, and if you're doing breast cancer, pancreatic cancer, then you can put in the different variants of that. It's up to you, right? Okay, so all right, so and I'm going to go back to that like that. Okay, and we just whatever you decide to put in through here. Okay, awesome. All right, so that's my website. Okay, and what I could do then is I'll go like this on the copy and paste. Okay, so my next one then would be okay. So this is going to be the topic I'm going to talk about right here. All right, I'm going to go back here to shape fill. Okay, come on, cool. All right, and I'm going to make it a shade lighter. All right. All right. Maybe I should make this a shade darker. All right. Let's see here. God, it's because my picture's in the way. Stupid thing. All right. So we did this. Yeah. Oh, you know what we could do even better than that? Let's do more fill colors. Okay. Cool. All right. So we're right here on that one. And I'm just gonna move it up a notch. Okay. To say here. All right. Or here. Right? Whatever we decide to do in terms of color. So you can choose your color, okay? So if it's shades of blue, or whatever I want to do. It's too purple. Something like this, okay? I know. How about this? There. That's what I want. Okay. Boom. Okay. Perfect. And then this right here, now, in terms of my shape fill, I'm just going to repeat it. All right. And I'm just going to go bump and bump and bump and I could have done better. There could be, again, the sky's the limit in terms of what you do in terms of color choices and palette, right? Oh, all right, cool. Now I would have to go back here and change the colors to match that, okay? All right, so you can see, so this is obviously the hyperlink within my website that I'm going to, right? And then you in here, okay, you would talk about chronic, you would say, oh, don't freeze, okay. And then you go chronic lymphocytic leukemia is the most common lymphoma found in older adults. Okay, I know this because of Julia's thing, right? It is predominantly a male lymphoma. Okay, on and on and on and on and on. All right. Now your clinic may only be a CLL clinic, and that's fine too. Right. I was just throwing this out there, so you don't have to do everything under the sun. Right. At some point, you're gonna, if you are doing CLL, then you would have to have, and you'd go on describing everything you want about it, and then you could have, a special hyperlink that is diagnosis. All right, how about we do this? Okay, symptoms. All right, and you would have diagnosis. Okay, prevention. If there's anything out there in your cancer, okay. Um, standard of care treatment. All right. we could then include clinical trials, right? And then down here you could do research that your group is doing, right? Boom. There, magic fingers, right? And so within all this, you then would have these things be, you could color code them to let everybody know, okay, that this guy right here is hypertext as well, okay? And again, you just, so from here, let's say this is the color code, okay? That's right here. Awesome. Cool. Okay. And then if I go like this, I go copy and I go paste. All right. Um, so this is the second one right here. All right. And so I don't need this. Um, I would have to, try and line it up. Okay. And then you would say maybe within this, and again, I'm just, lining up during in the section of diagnosis. Okay. Just to let me know that I'm in diagnosis section, I would go over here and do something like this. Okay, so now I know that I've clicked this hyperlink, and then you go up, and then you would be able to, create a separate text box where you talk about the procedures or methods you use to diagnose CLL, and then um, and then you would also then educate them that these same methods will be used to monitor progression of your CLL. You could say acting as a surrogate marker. Okay, and this would be progression without treatment, progression during treatment, etc. All right, awesome. All right, so that would be all right, and you would put that here. All right, so these are just ideas. All right, so just be creative. You don't have to do anything like this, but this is a way to structure things. Okay. When you use this, okay, so this is this method that you would use. You can provide imagery in terms of this diagnostic procedure, okay, as best you want. So I would come over here and see CL diagnosis. All right, let's see what would come up here in terms of images. All right. So this YouTube looks pretty informative. Okay. This right here looks pretty informative. Okay. Yeah. So what does this say right here? Let's check it out. Diagnosed classification leukemias. Okay, what do we have here? All right. Oh, look at that. All right. So here's some, an image that you would use. So, so you would do from a blood sample, you would do a bone marrow analysis. You're going to do genetics analysis. So this is looking for chromosomal aberrations. Okay. FISH tests. Okay. This right here would be immunocytochemistry staining. This right here is flow cytometry. This right here, okay, is would be maybe example of the more modern genetic approaches, okay? And so you could just, again, mix it up in terms of how you want to do it. So yeah, so and that's basically how you do it, guys, right? So I don't know if this helps at all, but maybe with this, I would look, we're looking at notes. Okay. Alrighty. So here's some imagery right here that you could use. Okay. Yeah. So again, here's some imagery. So you can research this. You're gonna find out what is the best images to support what I'm talking about. Okay. All right. So here's another part of this that could be really important to you. What about CLL? Okay, clinical trials, right? So here's a clinical trial right here. All right, so we kind of look at this. All right. Um, this is, about clinical trials. So it would explain to your patient, what the clinical trial is all about. So that's one way of doing this. Okay. How about that one? That looks like a good one down there. CML, clinical trial, phase 3 from Novartis. All right. So this gives you a little description, all right, about it. So you describe the study, what it's all about. Okay. Eligibility criteria, So here's an example, and you basically can plagiarize this. Okay. You're drawing this off the web, but you're pretending like it's your own. Okay. How people enroll in the clinical trial, on and on and on and on. Okay. All right. So that's one approach. If you decided that you were going to have clinical trials as one of your tabs. Okay. All right. So hopefully this helps. Obviously you're gonna have to spend some time on this. Okay. That's why we made this a final project. And the good news is you don't have to worry and about the final exam, because you're going to do this as a team. All right. All right. So that's basically my take-home message to you guys on this. I'm going to leave it at that. There was some questions about citations that Hannah brought up. So yeah, do list citations, and then just reduce the font size and just include maybe a citation at the bottom, whatever it is you're describing. There's my dog making really nasty noises. So, all right, that's it, my friends. I'll see you guys tomorrow.